Welcome to Agam's lecture series, a series of lectures designed to bring learning to the comfort of your homes. Today we are continuing with our discussion on the course STB 212 Pathology, Part 4. And the topic of discussion today is inflammation. Inflammation. What is inflammation? By definition, inflammation is local response of living tissues to internal or external stimuli. Internal stimuli is called endogenous. External is called what? Exogenous. What are the causes of inflammation? Cause of inflammation will include physical agents. Example, mechanical injury, temperature and pressure changes, radiation. 2. Chemicals can cause inflammation. These chemicals will include drugs and toxins. 3. Biologic factors. Infections and infestations by microbes, whether the microbe is virus, whether it's bacteria, whether it's protozoa, whether it's filaria worm, all microbes can cause inflammation. 4. Immunologic changes like immunodeficiency in AIDS, hypersensitivity, autoimmunity. These can cause inflammation. What are the types of inflammation? There are 2 types of inflammation, namely acute inflammation and chronic inflammation. We're going to discuss acute inflammation. What is acute inflammation? Acute inflammation is immediate and early response of cells to stimuli. It is of short duration. It can last for minutes or for days. It's characterized by what? Release of fluid, body fluid, what we call exudation. It's characterized by release of body fluid, which we call what? Exudation. What are the cardinal symptoms of acute inflammation? There are 5 cardinal symptoms of acute inflammation or signs of acute inflammation. One is redness of the spot. And this redness is caused by dilation of blood vessels in the damaged tissue. Redness of the spot. 2 is heat. Increased blood flow to the damaged tissue, which we call hyperemia. 3, swelling or tumor, which is just accumulation of fluid in the damaged area. 4, pain. You feel pain in the area. And this may come by stretching and destruction of tissue in the area. 5, loss of function. You touch the place, you are no longer feeling pain. You feel as if the place is dead, simply because there's inhibition of pain. Why? What are the effects of acute inflammation? Events of acute inflammation. There are 2 major events that happen in acute inflammation. One is vascular response. Vascular has to do with blood vessels, and cellular response of the cells. In vascular response, there is vasodilation and vasoconstriction. What that means is that increased blood flow and decreased blood flow. Increased blood flow and decreased blood flow. That's what called vasodilation and vasoconstriction. Then we look at cellular response. There's 4 steps or events in cellular response. One is migration, rolling, pavementing, and adhesion of white blood cells. Migration, rolling, pavementing, and adhesion of what? White blood cells. 2 is transmigration from one point to another. 3 is chemotaxis, movement induced by the presence of chemicals. 4 is phagocytosis, eating of the white blood cells or the cells for that matter. What are the effects of acute inflammation? There are 2 effects of acute inflammation. Some effects are beneficial, while some effects are what? Harmful. Let's look at beneficial effects of what? Acute inflammation. 1. Dilution of toxins. It can dilute the toxins that get entering into the body. Production of protective antibodies. It can cause the body to produce protective antibodies. 3. Fibrin formation. When a wound is to be healed, fibrin are formed. It leads to also clotting of blood. Then plasma mediator system. Then cell mutation. Then promotion of what? Immunity, defense. What are the harmful effects? Tissue destruction, swelling, inappropriate or exaggerated response. These are the harmful effects. We say there are two types of inflammation: acute and what? Chronic. We are finished with acute. Let's look at chronic inflammation. Chronic inflammation. We said that acute is immediate and early response, which is of short duration of few minutes or days. But in chronic inflammation, it's prolonged periods of inflammation. It can last to weeks and months or even year. What are the causes of chronic inflammation? Microbes. This microbe can be bacteria, it can be fungi, it can be protozoa, it can be viruses. All are called what? Microbes, especially pathogenic microbes, the ones that are capable of causing disease. Two is prolonged exposure to non-degradable substances that cannot break down in the body, and you're exposed to it and you start taking it into the body by bioaccumulation. You take it and they stay for long and they cannot be broken down or degraded. Then three, progression from acute inflammation. You have acute inflammation and it continues to linger and enter into what? Chronic inflammation. Four, autoimmunity. These self-internal reactions to antigens in the body, something that can cause all those type 1 diabetes. Then five, persistent infestations and infections. You know, tuberculosis, some people suffer for 10 years, for 20 years, for 30 years. It has lasted for years. Yes. Example, tuberculosis, persistent infestations. Now, what are the cells involved in chronic inflammation? Two major types of cells are involved in chronic inflammation. These cells are the monocytes and the macrophages. The monocytes and the macrophages. What are the systemic effects of inflammation? What are the effects of inflammation? The effects of inflammation will include fever, endocrine metabolic response, behavioral response, weight loss, etc., etc. If you are thrilled by these lectures, click on our red subscribe button so you can get subsequent lectures. Thank you. My name remains your lecturer Agama, and God bless you.